If somebody you know is very ill and about to pass on, and all medical treatments and procedures have failed, I'm going to give you 4 suggestions of a medical maneuver that you can discuss with your doctor. And these are scientifically backed, but they are new and they are not widely practiced. All right, but any smart doctor you discuss this with will understand, research more, and you guys can see if you can try it. Now, before I start giving you these suggestions of how to resurrect the dead, click this plus sign to follow me if you're not following me on TikTok, and click the share button to share. If you're not watching from TikTok, please go to my TikTok, look at my name, search for my name, the biggest account there, and follow. And of course, when you follow me, try and watch more of my videos because they are mind-blowing like this one. The first one is, if you don't want to watch, don't watch, but because it's about excreta, okay? The first one is fecal microbiota transplantation, FMT, okay? Also known as fecal transplant, a medical procedure that involves transferring healthy stool from a donor into a recipient's gastrointestinal tract, basically your intestine. They take poop from a healthy person and transfer to the sick person. And they said the success rate is nearly 90%. Success rate nearly 90%, at least in preventing this particular sickness, okay? But then there are other sicknesses, all right? When you do more research, you will see. There are more information here. Look at this. For example, a study in children found a 7% success rate, okay, in some sicknesses. There's a little risk, but remember that the situation we're talking about now is a Hail Mary situation. For instance, there's a risk of transmitting infectious agents from an asymptomatic donor to recipients. A good example is this. This woman was having irritable bowel syndrome, but her brother wasn't having it. So doctors decided to perform this maneuver. They took the shit of her brother and transferred it to her, okay? And even though her issues got resolved, she developed acne, just like her brother. That is proof that most of your acne is actually coming from your intestines. So it's an effective treatment for certain conditions. So if you know somebody that is sick and not responding to treatment, and everybody knows, low-key, that this person is going to the grave, it's just a matter of time, this is something you can discuss with a doctor, especially younger doctors that are smart. They already know the proper research they have to do, and maybe they have even performed it before. But the success rate is really high. There are some extra information. For instance, after the transfer, patients may experience diarrhea for a few days, okay? But most people feel relief within 48 hours. It can take up to 3 months for the gut bacteria to resemble the donors, okay? And if symptoms return within 4 weeks, the procedure is considered a failure. So you have 1 month to tell whether it worked or not. So how do they do this? There are many ways. One is colonoscopy, okay? There are many ways they introduce the poop of the person, like 4 ways, into the body of the other person. But one is actually just to put it in the mouth. But there is this machine called capsule filling machine. So this machine is a popular way to do that, and as you can see, it's affordable. What they do is, this machine is what makes capsules. When you take drugs that have capsules, do I have anyone here? So this machine is able to put something into a capsule. It will now be like a tablet, okay? So it will print, this machine can print like 100 tablets at once. So once you put it, there's a way you do it. You can watch the video on YouTube. It's simple, and you can discuss that. So the person will just take it as drugs without feeling the whole thing that comes with, you know. But remember, it has to be from a younger, physically fit, healthy person to the sick one. And remember that if that younger person has some diseases, they may transfer it too. So the person has to be physically fit. Discuss with your doctor. 2 is this one. Blood transfer from a younger, physically fit, healthy person to the sick one. All right? First thing, scientific community is still debating the safety and effectiveness of young blood transfusions for anti-aging purposes. And there is limited clinical evidence in humans, okay? Limited. It doesn't mean there is no. It means that the evidence is small. Some clinical animal studies suggest potential benefits. So they have tried it on animals, it worked, especially mice. If you read more, all right, if you read more on these links on mice. So some of the mouse, okay, some of the mouse were old and having all these arthritis and diseases of old age. They transferred blood from the younger mice into the older one, and many of those diseases disappeared. They also did the reverse. They transferred from sick old mice into younger ones. The younger ones developed sicknesses of old age. So if you are sick in the hospital, it's good to pay attention to the blood they are giving you. If they are giving you blood from somebody that is sick, you might heal one sickness, like performing a surgery, they top your blood, and then you start developing other sicknesses. So be careful where you're getting your blood from. But the idea is, if an older person in the family is sick, you take blood from a younger person in the family that has the same, that their blood match. There has to be a match in the blood. You don't just take blood anyhow. Doctors already know how to perform. That's why you discuss this idea with your doctor. So let's say there's somebody really sick, having different diseases, taking so many different drugs, struggling with this one and that one in the family. You can discuss blood transfusion. So you test all their children or grandchildren, all right? The grandchildren that have the best match, they can donate blood to the person. So sometimes this blood is donated 3 times, once every 3 months, for the whole year, okay? And a lot of improvement is expected. Now, this is also suspected to be anti-aging. This is why many foreign celebrities actually do it. It's not that they are sick. They want to stay young. So every few months, they take blood from a younger person to prevent aging. That's why they say it's still debated. The third one, remember there's a fourth one coming. The third one is if you are in a hospital and they are treating the person with a hospital with certain doctors and the person is not responding to treatment, don't wait for them to die. Package them and send them to another hospital. According to these studies in the US, of all countries, the best country in the world, medical errors account for 9.5% of all deaths in the US each year. Medical errors. So doctors make so many mistakes that so many people die, up to 9, this is 10% of people that die in US each year are dying because of medical errors. Not because of the sickness that took them to hospital. They are not supposed to die, but the error. Making medical malpractice a leading cause of death. In fact, by some calculations, it's the third leading cause of death after cancer and heart disease. You now get medical malpractice. Look at this. Based on that study, at least 250,000 Americans die each year due to some sort of medical error. This is US. Now imagine Africa. Just imagine Africa, where the roof of the hospital is leaking. Imagine how many people that have lost their life due to medical errors or misdiagnosis. Sometimes you are telling them that something is wrong, but they are doing their test. They are testing for something different, and they are telling you that you're okay. Or they are giving you antibiotics when something that the problem you are facing is another thing. Or some situations where the doctor's cousin is the owner of the lab, and his other cousin is the owner of the pharmacy. So they keep sending you to pharmacy to buy expensive drugs that is not related to what you are facing. Meanwhile, they know that they don't have the equipment to treat the health issue you are facing. So if your patient, if your family member or you're not responding to treatment, change hospitals, move to another city, move to town. Do you understand? Change hospital. You might be amazed, and then when you redo the whole test again, they might really find what is wrong with you. All right? Don't stay there and lose your life. Then finally, if a type of medicine is not working, try a different type of medicine. For instance, if Western medicine is not working for you, like hospitals and doctors and all those things, if they're not working, you can try native medicine. There's Ayurvedic medicine too. Okay? Herbalists. I'm not saying voodoo priests. I'm not saying pastors. I'm not saying people that consult the gods and give you egg to break at night. No, I'm talking about people that use herbs, mash it together and give you as treatment. Okay? So this is the one I'm really good at. Okay? So when you reach out to me with such distance, I look at your test results. I can suggest from herbs. You now discuss with your doctor, because doctors know some of the contraindications with these things and whether it will work with the medication you are currently taking. You know, some of these herbs, you'll be introducing it small. You don't just take full dosage. As you are reducing the tablets you are taking, gradually you transition, and then gradually you recover. So you have to discuss with your doctors. I can only make suggestions. My suggestions are not free.